2020 was a year that no world leader was fully prepared for. It was also a time that Canadians turned to our federal officials for answers and action as we battle a global pandemic. In my one-on-one interview with the Prime Minister, I asked him about some of the mistakes he may have made, plus the largest immunization program in Canadian history.
We now know that with vaccines, there is going to be an end to this.
Canada now administering COVID-19 vaccinations 9 months after the World Health Organization declared a global pandemic. The Trudeau government touting their early and diverse procurement plans, securing millions of doses of shots from various companies. The plan right now is to have enough vaccines to give the entire nation by September. So the question is, what percentage of this population needs to be inoculated for us to say this pandemic is under control?
That is a great question, and it's a question I seem to ask every couple of days of the experts and scientists I talk to, because we don't yet know. There's going to be a lot of studying of the impacts of the vaccines, of the effects of the vaccines on when we can start looking at removing or releasing some of the restrictions.
The PM saying he expects things to be much better by summer 2021. But when will he be vaccinated? When it comes to world leaders getting the shot, the message is not consistent. In the U.S., the top doctor on the COVID file says President-elect Joe Biden should be at the front of the line.
For security reasons, I really feel strongly that we should get them vaccinated as soon as we possibly can. You want him fully protected as he enters into the presidency in January.
Dr. Fauci also recommending Vice President-elect Kamala Harris, as well as President Trump and VP Mike Pence, also get the shot. In the UK, Prime Minister Boris Johnson has already said his priority is to see the vaccine given to those in the vulnerable population before he rolls up his sleeve. As for our Prime Minister, he too says he'll wait, likely until April, when it's expected to be available to the general public.
When there's a time for healthy people in their 40s to get their vaccine, when it's our turn, I will be as close to the front of that line as I can get. I am super enthusiastic about getting vaccines. I certainly want to show people that they're safe and that we trust our doctors. But there's a lot of vulnerable people who need to get these vaccines much quicker than I will.
Looking back at this tumultuous and somewhat unpredictable year, how does the PM rate his decision-making? Is there anything that you feel you got wrong that you would have done over?
We all know there's lots of things we would have done differently. This was an unprecedented situation. But if I went back, when Dr. Tam started telling us about the potential of the concerning news coming out in January, coming out of China, we would have immediately turned around and started to procure lots of PPE, because that scramble in the beginning of the pandemic in March and April, where there were real concerns about frontline health workers who were reusing masks and having to bring them home and wash them, that was something that I would have loved to have been able to avoid.
As for the individuals in need of that PPE, they, the frontline workers, named Canadian Press Newsmaker of the Year. No surprise. And the reason here, their resiliency and, of course, the sacrifices made during the pandemic, but also drawing attention to inequality and making calls for both programs at a national level for sick days as well as childcare. For City News, I'm Melanie Ng.